continuing our conversation with Dr. Qusai Hussain, who is the CEO and also the founder of Cyber Clinic. Doctor, I need to start this conversation and again let the audience know that there's a brand new tool to assist us with, and to assist you especially with providing assistance for those who are struggling with their mental health at the moment. It's called Cyber Clinic. Tell us not only what it is, what drove you to do it, and how easy it is to use.
Yeah, so look, I've been a practitioner for over 15 years, and one of the biggest difficulties and the common complaint that I get from patients is navigating the mental health care system and finding the right care. So that's really what the design around Cyber Clinic has been, is to give people an opportunity to be able to get onto an app, download it, free of cost from the stores, and then immediately be able to connect with a mental health practitioner using the algorithm that we have. So we have a series of questions. It takes about 5 minutes to do, and then it connects them to their best fit practitioner. Now, if you look at the traditional model of delivery in terms of connecting people to care, it used to be you go to your GP, the GP will make a referral to someone usually in their local area that they know, or you go onto Google and then you scan through a whole series of sites to find a clinic or a practitioner. So what we have done is we have taken that away, because really you don't want people to be going onto sites and looking for their own practitioners without even knowing what it is that they're looking for. That's part of the problem. So we've designed the app to really ask them a series of questions, which allows them to then get matched based on the algorithm that we have created, which then also gives them ongoing information about their mental health journey and their treatment outcomes. So the entire purpose behind the app is to get a better match and to get better outcomes. And so what we have found since the pandemic is that we have now had almost 100% month-on-month increase in registrations, and almost a 300% increase in consults on the platform. So people who
are we talking
aware of it
nationwide,
are using,
or are we talking just Victoria, Doctor?
Nationwide. Yeah.
Nationwide.
No, this is nationwide. So
That's very exciting.
A national. Yeah, it is. Yeah.
So
and we also have the ability now to.
No boundaries, and you're not limiting anyone. Whoever needs assistance can reach out to you and download the app Cyber Clinic.
Well, that's right. And if you think about scalability, that's really what you want, right? In a pandemic like this, you want to be able to scale very quickly, and we've been able to do that. We've got hundreds of appointments a week available on our platform. But interestingly, when the bushfires happened, in the early part of this year, we released free sessions on the platform for people, and we were able to provide almost 400 appointments a week within 24 hours. So that's the level of scalability of a platform like Cyber Clinic, especially in the context of a pandemic, and especially when we're now seeing that the rise in mental health difficulties is going to continue to go up.
Now you shaped this app from the very beginning, and I suppose now with as the emergency, or as this pandemic shifted and changed our lives, you've been able to tweak and shift and change the app as well, have you not?
Yes, that's right. So when we started out initially, before these telehealth item numbers were available, because that was a barrier, because people couldn't get Medicare rebates, we were focused on in the B2B market. So we were focused on corporates, government contracts, and through those contracts, we were then providing services to people because it was paid for by insurance companies, organizations. But as the pandemic hit, and we've been really busy during this period, we've had to sort of pivot the model to go directly to the consumer.
So are we getting better therapeutic outcomes?
We are. So on the platform now, what we have found is that in our last month statistics, when we looked at it, we found that now almost more than 75% of our practitioners have a therapeutic alliance of 95% and higher. So what that means is that their engagement with their patients that they're seeing is more than 95%, and the satisfaction of patients is more than 95%. So we're actually getting really good outcomes with the patients that we see on the platform. The benefit for them is, of course, that they can connect and then they can get all their Medicare rebates online. And as you may or may not be aware, but now the government also introduced, previously when you go and see a GP and get a referral, you would get 10 Medicare sessions to see a psychologist.
Yep.
Now, with the second lockdown, the government's now, putting some more money, and now they've increased it to 20. So now people have the ability to get 20 sessions. So this is where you're going to get the continuum of care, and this is where you're going to get the support. And this is what I see all the time, with the people that I'm working with. And the 10 sessions were never enough. You really needed more sessions. So 20 sessions is a start in the right direction. But what we'll really need now is we will need more funding to provide more services to people.
Listening to you tell us that the 10 visits was not ideal, and in fact was way below what they needed, and 20 is in the right direction. I'm reminded of a conversation only last week on TheInformer, where we had another professional tell us that this is a drop in the bucket. This extra 60 million that the government has put in is but a drop in the bucket, and we need to spend a whole lot more. Can you see the data from Cyber Clinic being used by yourself and others to make a better case to government, to say to them, look, these are the results we're getting, but we need more support, or we need more dollars thrown in?
Yeah, absolutely. So if you look at the current model of funding by the government, it's really what we call an activity-based funding. So what they do is they give you money per activity or patient that that's going to come in, and then they've got a certain number of sessions allocated. So like they've got these 10 sessions allocated to anyone who wants to access.
Right.
The difficulty with that is that we know that some people need a little bit, some people probably need much more. And so the way that the funding model works is it doesn't allow you to shift and change those number of sessions per person. So through our platform now, and through the outcome data that we're actually able to provide, we can actually give government some really great information about who's using what number of sessions, how many sessions they're using, and the ones that are more severe, more critical, how many more they would need. So our platform now is moving more towards what we call precision therapy. So you may have heard of precision, medications, where now you do genetic testing to work out what type of medication is best for the individual. Our platform is now really focused on precision therapy, which is really identifying what type of therapy and outcome is going to be the best for any one individual that comes. And that's using machine learning, using AI technology. And this is really where the funding should go. So a lot of the government funding, unfortunately, continues to go to the same places. They're not moving a lot of the funding into technology and looking at sort of more creative ways in which to actually provide services to the people. As far as we're concerned, what we're seeing is that the demand by individuals has continued to go up. As long as people know that there is a service like Cyber Clinic and they can access it from the comfort of their home, get connected and continue their sessions and get the outcomes, they're going to use it. But they need to be aware that that's a service that is available for them and should be available for them at a national level.
Well, that's the whole purpose of what we're trying to do on TheInformer, Doctor. Let people know that there are apps, there are new ideas, there are new ways to counter some of the oldest problems in the world. We have a massive mental health challenge, as you touched on at the beginning of our discussions. We need to get on top of it. This is Cyber Clinic. It's an app that anyone can download. How are you finding the ethnic communities? Have they come to the party? Have you spoken to anyone with the Ethnic Communities Council to help break down some of the communication barriers, to let those fragile communities know that you're out there?
Well, they do. I mean, I'm an ambassador for the Mental Health Foundation of Australia, and they're very active. The Mental Health Foundation is really active, working with ethnic communities as well. So they've been getting a series of information out now around support groups, webinars, information to them around, breaking those barriers and the stigma that still exists within some of these ethnic communities around getting access to healthcare. But that's also where technologies like ours can actually come into into the realm, because it provides a really a private way in which people can actually access service. They don't have to go out anywhere or tell people where they're going. They can access it from the comfort of their own homes or in their rooms. Many times now, because of COVID, unfortunately, I get patients, because everyone's at home, right? So that, the kids are at home, all the partners, everyone's at home. I get patients now who, get into their cars and do the consult with me on the phone in their car. It's that easy to do. Now, if we didn't have a system like this, there would have been, hundreds of people who would have gone without actually getting the care that they needed.
Well, I can see how that problem would exacerbate, especially in a home and we don't all have mansions. We don't have the left wing or the right wing or the west wing. And I can imagine people saying, I want 5 minutes, or how long does would a session, and I understand it's how long is a piece of string, but a normal consult, how long would it take, Doctor?
Well, on average, our consults are generally, anywhere between 40 to about 60 minutes.
Okay.
So that's an average consult. It depends on what the patient is really coming for. But if you're doing a proper, therapeutic session, which has been planned for and you've organized with the patient, it would generally take, on average about 50 minutes or so.
Well, we wish you continued success. The product is Cyber Clinic. It's available for download. Dr. Qusai Hussain is not only the CEO, but was the founder of this fantastic tool. Let's hope we get more people to embrace the technology and use yet another specific tool that you've built, purpose-built, to provide them with the assistance they need at this crisis time in their lives. Thank you, Doctor.
Thank you very much, George. Much
Pleasure.
appreciated.
All the very best, and thank you again.